This is Steve Zeltzer with Workweek, and I'm here at the California Labor Federation Convention with two organizers at Starbucks who have been talking to the delegates about their concerns, their issues, and why they're organizing. So welcome to Workweek.
Yeah, thank you.
Your names?
Joe Thompson.
Noelle Bennett.
Okay, so maybe you can talk about what is happening at Starbucks and why you've decided that you have to have a union.
Well, so there's a lot of reasons. We're both at the same store in Ocean Water in Santa Cruz, and we started organizing back in November, and there was just constant issues with staffing and having our schedules. There's a lot of issues at Starbucks, and a lot of it had to do with our managers not being responsive to us and not listening to us.
Yeah, and it's a lot about having a voice on the job, We're the ones that are on the floor, we're making the coffee, we're having customers come in, we're the customer connection people, and we believe that we should have a voice in the job.
Well, Starbucks has argued that they take care of their employees. They're concerned about the employees, and it seems like they've changed their tune lately.
Yeah, so they offered new benefits and new wages to non-unionized or organizing employees.
Is that legal?
They claim it is. It's going to be up to the courts to decide that, which, we take the stance that it's not. It's a direct attack on the unions and on the organizing, and it's a threat to stores that are trying to unionize, and it's directly impacting not only the current workers and morale, but it's also showing that Starbucks is not really, in true faithfully, good to the workers.
And it's about, not being willing to bargain with us, It's about, they are choosing not to even bargain for these new benefits with us. And
what do they say? What's the reason?
They're just saying, we can't. We just can't. That's how the law is, And that's not how it is, technically. So we're just waiting on the bargaining.
Yep.
And has there been a use of intimidation and targeting of union members?
Yeah, so there's a lot of retaliation going on, especially with, there's anti-union literature in stores, labor shortages, or labor cuts, I should say, to schedules. There's, Memphis 7, all 7 workers were fired in Memphis that were all organizing in the organizing committee. It's happening everywhere, but, we're stronger together, and we've got this, and we're stronger than them, so.
Yep.
And I understand under social media you've linked up. People are excited, and when you have one victory, all of the members throughout the country. Can you talk about the use of social media to organize?
We've been using social media, Twitter, Instagram, TikTok, and everything to communicate our message and show that workers are united across not only California, but the entire country.
And how does that affect people?
Yeah, social media is the way to reach people, especially customers. And a lot of the time people feel like it's just like work is at their own store, especially coworkers. Like the work ends when they leave the room. But in reality, we're able to reach out and be able to help people in the stores by using social media and getting it out there that, we are here to help, where we want to be able to, get the ability to have our benefits solidified. And it's a great way to reach out.
And they've said, the owners, they brought in the past CEO, that they provide great benefits. You're saying that's not the case?
They provide okay benefits. I get my health insurance through Starbucks, and I've been there for almost 3 years now. I get decent pay, but in reality, we still don't have a voice at the job. And the union protects us. It protects us from being fired unjustly. It protects us in negotiating a good contract. And overall, without the union, our voices are diminished. Starbucks can do whatever they want, whenever they want, and even in their own benefits contract, they can take away those benefits at any moment's notice.
So it's company prerogative if you don't have a union.
Exactly.
And how has it changed you being in a fight to organize at Starbucks?
Oh my gosh, I feel like I can actually make a difference. I've been working at Starbucks for 3 years. I've had baristas come into the back room really upset, stressed out, crying, having panic attacks on the floor, and I wanted to do something, So I became a supervisor in the hopes that I could fix the workplace, but I realized that wasn't enough. But when I heard about what Buffalo was doing, and when we learned about how they are able to have change in the workplace, that's when I realized, okay, this is how we're actually going to be able to have a voice and actually get together and feel, have camaraderie amongst each other and be able to stand up and have support.
And I read that they actually brought in managers. They had training sessions, one-on-one, to convince people they shouldn't have a union. It seems like they're spending a lot of money to prevent unionization.
It's almost they've probably spent at this point more money than it would cost to give workers, a decent contract and better benefits. It's because they know that there's more power in unions than anything else, and they do not want us to have a union, and they don't want workers to realize the true power they have.
And how are you connected with other Starbucks workers? Do you meet, or what? How are you organized?
Yeah, right now we're just trying to, especially social media is one way to get that out. But also we've been, coming into stores with shirts saying, "Hi guys, how's it going?" Just ordering some coffee, sparking up conversations, and it's all about feeling like we're in this together, bringing everyone together, that we all have the ability to support each other.
And the pandemic, the stresses that people have, how has that affected the workers at Starbucks?
Yeah, so the pandemic has been a huge fire that's been lit under the labor movement, and people finally realized that Starbucks was pretty good with benefits at the very beginning. They offered hazard pay, they gave people time off. The second they realized that wasn't profitable anymore, they stopped. And that's when a lot of people had to go back to work, and they had to choose either work at Starbucks, get a second job. And they're finally realizing that Starbucks doesn't care about them, and Starbucks really is only in it for the profit and the money.
So a lot of workers have been quitting. They're angry about their conditions. Is that the case at Starbucks as well?
I mean, for sure there's been a lot of that going on, but also a lot of us care about each other at the job, and we do like our jobs, and that's why we're still doing this. That's why we're here. We enjoy making coffee, we enjoy talking to customers. But we just want that extra level of the workplace, also our company also being with us and all of that.
And what can people do who want to support you?
So we're now launching a campaign for no contract, no coffee. Just an asking people to sign up. If there's any actions around you, we'll be notifying them and asking people to get 10 more people to sign on to it too, just to show Starbucks that we have power behind this movement and people want us to win.
You think you're going to be successful?
Oh yeah.
Got to continue fighting.
Victor Pius.
So Victor, you're with AFG. Why don't you talk about what AFG is and what your concerns are?
Yeah, so I'm with AFG. We're the American Federation of Government Employees. We represent federal government and DC government workers. My local union, we focus on representing the TSA workers in Southern California.
And what concerns do you have about privatization or just other issues?
Well, privatization is something that's always on the forefront in our areas, given the discretion that the law, when TSA was created, it gave a lot of discretion to the local airports. So we're always having to monitor the different airport authorities to see what they're doing. Fortunately, in Southern Cal, we've been lucky that we're never really in a position where they're trying to privatize our services. Up here in Northern California, about a decade ago, the Sacramento, the county board there, kind of sneakily had a vote in secret to submit an application to privatize our TSA federal workforce up there. But we had to mobilize and defeat that, and we were able to push that back with the help of the county central labor councils and obviously with the California Labor Fed. So that's always something in our forefront to consider, that some of these things can happen very easily overnight. Right now, obviously, in general, our concerns are safety in regards to COVID-19.
There was just recently an outbreak in Los Angeles.
Correct.
Were your members affected by that?
Our members are still affected by that. And we are concerned because some of that recovery periods have been shortened based on guidance from the CDC. And unfortunately, I think we've always had concern that some of that guidance was modified because of feedback from industry, from corporate interest.
They didn't want masks.
Yeah, correct. So obviously those are concerns. When we used to be able to isolate for up to 2 weeks, to make sure we're not spreading that, now it's kind of pretty much limited to 5 days. And obviously that's not just with the folks at TSA, but other partners at the airport. So, it just leads to rampant widespread outbreaks, such as we're experiencing right now.
And your members, if it's only 5 days and you're still sick, if you go back to work, you're going to infect other people, people who use the airports.
Correct. I mean, it's so hard to limit the spread of some of this when folks don't know for sure that if they're trying to extend their stay away from work, how receptive, the agency will be to that extended period of,
How many members have gotten COVID? Any idea?
So the unfortunate thing is TSA used to publicly promote this information out there on their website, but as of a couple months out, they took this information down. And at that last count, it was about 23,000 TSA employees nationwide had acquired COVID-19 during this pandemic. And this is a workforce, maybe in total approaching 50,000. So it was about 50% of our workforce. And as you can see right now, that there is a kind of an outbreak going on at LAX among TSA and other employers there at the airport. You just know that numbers keep going up.
And this must cause tremendous stress for your members, their families, infecting their families if they get sick.
Yes, very much so. At the end of the day, with folks don't want to be sick, they don't want to be in the position, and obviously they don't want that to be spread back to their families.
So what can the public do about it? I mean, people who want to fly but are afraid to, going to an airport with no masks, no regulations, it sounds pretty dangerous for people who have vulnerabilities.
It is very, very scary. I mean, I would hope for one thing that folks that are sick, please do not fly. There's only so much we can do to control our part because we're required to be there as essential workers. With the flying public, I think they have a little more control. If they're sick, I think, rather that they're not coming through coughing on my members,
And I mean, it sounds like they want this to be the new normal. Don't let people know about people who are sick. Keep it quiet. It sounds like that's dangerous and could be even deadly to your membership.
It is. I think we need to share as much as information about this, and I think it's so folks are informed about their decisions, whether that's as a traveler or whether that's us as employees or the members of my union, to kind of know what they're up against. We need to be informed in these decisions that we make.
Okay, thank you. And how can they get in touch with you, your organization?
You can reach out to me by text at 310-431-6960. Once again, 310-431-6960.
Shama Aslam. Today I am actually part of the SEIU Healthcare Initiative, and I am here trying to provide or get more services for the dialysis patient. I have done dialysis for 4 years. Straight, I was doing dialysis for 3 days a week for 3 hours a day, and
You had a problem with your kidneys and
so it's nothing that I did. I was born with polycystic kidney disease. If anybody doesn't know that, basically what they are, they're little blisters and they pop, they hurt really bad. So basically I have polycystic kidney disease throughout my body, but my kidneys were first to go out. And especially after I had my third child, they said that they said that I should have not had the baby because I could have died because of all of the trauma from the baby and the delivery. I didn't know that. Doctors did not inform me about that. So after I found out, in a way, it was good that I didn't know ahead of time. So anyways.
what were the conditions in these dialysis centers that you had to go to?
So basically, and that's what we're here for, the dialysis clinics. I would say I have gone to Sacramento Clinic, I was at Hawaii Clinic, I was at Stockton Clinic, and also San Francisco. And I know a lot of you don't know people that are actually not doing dialysis. They drop their patients or their loved ones off, and they don't really go into the clinics. One of the main things that really bugged me was they usually, the clinic that I was at, they had gnats. These little flying things would come and sit on your face. So when they actually hook you up, you can see it. So what happened was I have this in the wrong place anyways. My arms start sleeping when I close it, so I'm still having issues with this. They had to go up higher so they can access further. So over time, these tissues, as you can see, the skin, it starts tearing. So they have to go higher in different spots. Sometimes you'll see the bumps here, sometimes here, and sometimes here. So luckily, I don't have the heart one. I think that's the scariest one. So going back to the clinics, we saw a lot of gnats flying around. There was a lot of smell. I had actually talked
This
to...
is at a clinic, for a healthcare clinic for dialysis.
It's a dialysis clinic. So over 4 years, this was happening. Summers, certain seasons even worse. I did complain to the director, And the answer I would get is, I'm sorry, we don't have a budget for that. Also in the clinics, there's staff-wise, there are very few nurses, so they're not even nurses, actually they're called technicians. So all they're trying to do is how to put in and put out. They have one nurse for the whole clinic. Usually there's hourly, actually people come and go. Its clinic is open sometimes 6:30 to 9 o'clock at times, even on Saturday sometimes. We never had a doctor on board. The doctor would come. I had Kaiser, so the doctor would come, a few minutes, checking in with a lot of clients at once.
So you're with Kaiser. Why doesn't Kaiser handle this?
I have no idea.
They're outsourcing it to this other clinic.
I believe so.
So it should be really a Kaiser operation.
Exactly. So I think that I don't know who needs to take charge. It's always passing the buck to one person to another.
So it's contracting out to somebody else other than Kaiser is handling this.
I believe that's how it works. So every time I would ask about money, it's always like, well, we don't have the budget for a doctor on board. And like I said, the doctors, it's not just one clinic. The doctors come out and they would cover a lot of clinics. It's not just one. So they're always in a rush covering a lot of patients, so you only get a minute or two. And then, of course, if you have a real problem, you got to call them. And I am a master social worker, and I learned how to text and email and go on the kp.org. But I felt so bad for the individuals who didn't speak English. They were a woman, she did not speak English. They're handicapped. A lot of the patients were without limbs, so they have to accommodate them. A lot of them, like I said, they didn't speak English. There's a, what would I say, communication gap, I would say. A few times, because they were in a rush, I know that when they patched me after the dialysis was completed, I went to the car and I bled. And I almost was home. I had to come back and drive back. So when you're bleeding, you're literally trying to, it's gushing, yeah. So the bandage goes on here after they put 2 thick needles. One is blue, one's red. So it's just, the big machine, all it does is circulates and cleans out the blood. And then they patch you. So when they're in a rush, they're going to patch you real fast. And this is very, very fast. This basically is my heart. So if there's any hole or any bleeding, I can literally die because it's my heart. And you can feel the pressure. This is not me doing it. If I push it down, it pushes you back. That's how difficult it is to even push down. But after they do the dialysis, they usually bandage you pretty good. So I bled twice, I believe. I really got scared. The first time, I almost got an accident because I'm trying to drive home. And that's another issue. I had a very hard time getting transportation. I had to drive to and from dialysis. And this happens to a lot of clients. I'm younger than the other ones that were coming. Like the lady that was coming, she was 102. So I don't even know if she had a transport or not. There were guys who were elder, or patients who had dialysis for over 7 to 10 years, or they had a kidney and their kidneys failed again. So this is a thing they were doing every day. And there was an elderly man, I used to ask him, like, you shouldn't be driving. I felt sad for him. I said, can I drop? He goes, I don't have a ride. So he was driving, and it's so dangerous to the community.
Where's the state of California in this? OSHA, the conditions in these laboratories, so-called laboratories?
Yeah, beats me. Like I said, I would talk to the director, and the only answer I got was, we don't have budget. And as you know,
they don't have any money to take care of people, even though they're being contracted out by Kaiser, which has $40 billion in surplus, but they don't have money to take care of them.
Exactly, and that was one of the reasons I wanted to find out, like, where is the money? And I would actually ask her that. I would ask the director, can you just at least spray this area? Because all the chairs are against the walls, and there's some kind of a little, what would you call it, drainage. And what I always heard was it's because of the drainage. So the blood that they were taking out, it goes to the drain. But there's a way for the mosquitoes and these gnats to come through, and they would buzz around you, and it's so disgusting. And of course, they're attracted to the blood. So they come around you, and I was always doing this. And
the Kaiser.
I was working for a nonprofit / private. They were half both. And I have always worked for nonprofits. And from unions and other areas, I found out Kaiser makes millions and millions. However, they're getting minuscule amount of money to these clinics. And it's not just that one clinic I went to regularly. Like I said, I was here in San Francisco when I had a convention here, and I had to do dialysis and then go back to the meeting. I was so disappointed. I was thinking they have a really nice clinic in San Francisco. They had one bathroom for both genders. It wasn't even handicap accessible. So if there's a handicapped person, they barely had maybe little room to get their chair in, and there was no room to turn around. It was so disappointing. So
I mean, that's illegal, isn't it? I mean, in a medical facility, not to have handicapped facility for patients, especially patients who have health problems with dialysis.
And dialysis is a long term, so it's not a temporary problem. And there's thousands of dialysis patients. So I was really, really surprised after seeing that one bathroom. It was very, even for me, it was kind of embarrassing because there's a man ahead of me, and then I'm waiting for go after the man, and there was another handicap. I thought that was ridiculous. Then I saw one in Hawaii. It was even worse. Oh my. That literally, the dialysis place was like a bathroom size, and they had the really old chairs, cleanliness. I mean, when COVID hit, I just wonder how they did it, because in my clinic, we didn't have PPEs. We were still fighting for PPEs. We fought for everything. I would take my own sheets and my own blankets and cover my sheet because I didn't want COVID. Because of lack of staffing, if one staff was out, the other staff had to deal with, I think they get 6 patients per tech. And if one tech was out, they had to cover the two, both her own or his own and the other person's clients. And
And the state legislature, where are they? We just had the governor here, Governor Newsom, governor of California. I mean, where's the state? Where's OSHA? Who's enforcing the protection of the patients?
And that's what we've been fighting forever, and it's always turned down. It's turned down. I wish they would go to the clinics. I have never seen any politicians go to the clinics. The only person I've seen the highest is the doctor. She or he would come from Kaiser or whatever hospital the patient is connected to and do really brief and then leave.
Does Governor Newsom know about this?
I hope so. Well, that's what we're trying to do.
He was here today.
Yeah, exactly. So today, if somebody's going to go up there and speak about it, he should, right? We're hoping. And I think they hear it, but it's not an issue because they don't have anybody who has a dialysis. They've never been to the dialysis clinic. It sounds really nice when you're outside, but once you go in, it's a terrible scene.
So what should be done about it?
Well, number one, they need to have a doctor on board. They need to provide them with equipment that they need. For example, just like I said, basic spray is not going to kill the gnats that are coming to your face. Okay. They need transportation. I think that's such an issue. It's an issue for the client as well as the community because the person that's driving, believe me, after dialysis, I was just almost out. And I fought with Kaiser to get a transportation, which they would give me for 3 weeks and take it off. So I kept fighting. But I am a fighter. I can advocate for myself, but others, they would just not know about it or just leave it alone or didn't have the energy or the I guess the confidence to fight for these things. I feel like I was the only one really standing up and doing that. So I did finally get 4 years of dialysis. I finally did get kidneys. So every time I pass by now, I still have almost like I would say PTSD. Because a lot of times I really didn't want to do dialysis. I wanted to give up because it was so horrific. Just the smell and the bugs and just going there daily and just the way it was. And
so you're fighting to save other lives.
Oh, definitely. I'm always doing that. I think it's so much needed right now. They made this beautiful clinic. I think Davida, they spent so much money on this new clinic. I don't know what's happening inside, but it's a nice building. And the clinics that are already open, they're terrible. They're just not taking care of the basic needs. And our immunity, so I'm taking medications, and I have been for a year now. I just got a kidney a year ago. The medications, due to the medication, they suppress our immune system, so I can get any illness very quickly. I actually took all the booster shots. I still got COVID. I had pneumonia. I had some kind of viral infection. I was inpatient for 2 weeks. So I'm always scared. I wear a mask all the time. I just have it off right now because of this. I wear it everywhere. I didn't go anywhere for almost a year. Of course, dialysis time, I was barely going out, but now, especially now, I can't be in crowds. So these clients, these patients, they're not going to get kidney. It depends on the age and, of course, the matching. And I think after a certain age, they don't really look for kidneys for these individuals. I was younger, I would say, and I got lucky. I mean, even for me, it took me 4 years to get anything. So I just hope and pray every day that these individuals, don't want to give up. I think going into a nice environment, they can make it nice, clean, inviting. These clinics are like, it's like you're sitting in the chair and you're in jail. You can't move.
And it sounds like for profit, they're privately owned and is basically making money off them.
Yes, I believe they're for profit and they're making a lot of money from these individuals. Like I said, there's millions of dialysis patients throughout the country. So they're making, I think it's like $5,000, don't quote me, per patient or something like
What do
that.
you think the idea of public health? I mean, you have all these private companies outsourcing, even Kaiser, which says they want to take care of you, or outsourcing to private operations that apparently, from what you're saying, don't have proper treatment.
No, I think it's all about money. It's all about money, how much they can make. As long as you get in there, they're making the money. I don't think they care about the treatment as much as they care about what they're getting per patient. So whatever's there is there. The time I was there at the clinic, I don't think they changed anything. It was just left. Unfortunately, I left. I'm glad. I'm blessed. I got a kidney, but these other, I made some friends. They're really nice, normal people. I'm sure they're still there, and they'll be there for a long time.
One of the delegates is a nurse who is president of CNA.
Hi, my name is Sandy Redding, and I'm a registered nurse, staff nurse of over 35 years in the operating room.
And what are your issues here today for working people in California and nationally that they should be concerned about?
I think that labor has a goal of making sure that everybody has a voice and a safe work environment, as well as being having equity in the workplace, and that they can make a living wage. But for the nurses, the pandemic's not over. We're seeing surges again. We want to make sure that we're safe. And here at the State Labor Fed Convention, we're all vaccinated, we're all masked, we're trying to be as safe as possible, distancing. And we want to make sure that the public knows that we'll be there for them, but we also want to make sure that we have safe working conditions. We're seeing short staffing all over California, and it's really an industry manufactured staffing shortage. It's not that there aren't enough nurses. The problem is there aren't enough nurses that want to work under these conditions.
What are the conditions that are driving people out of the industry, nurses, trained professionals out of the industry?
Well, it's what we call the acuity of the patient that we're taking care of. That means how sick they are. So we're seeing sicker patients. We're seeing higher incidence of COVID patients. If people can't breathe, we have to, prioritize and make sure that we get to the call lights as soon as possible so that we can increase their oxygen, give them the medications they need. We're there to heal. And when we say we need the resources and decent staffing and to be able to take a rest period or have meals, right? Influx of travelers from different states.
That's a big problem. It seems like a lot of hospitals only have travelers, or a large number of travelers.
Well, we want to make sure that the community nurse is taking care of the patients in the community. And we want to make sure that we have the proper PPE, the personal protective equipment, so that we...
Is that still an issue? 2 years, more than 2 years after the...
It comes and goes, and it depends on which institution you're working for. We want to make sure that we can have single-use personal protective equipment. You don't send a firefighter into a fire without personal protective equipment. It's just basic common sense. So because we have a union, we have a strong voice, we have pandemic task force language in our contracts, and we take on our corporations to get what we need. But we shouldn't have to fight this hard. Our jobs are hard enough and stressful enough as it is. And what we want to do is take care of our patients, give excellent care. And in order to do that, thank God we have a union behind us so that we can advocate.
And there have been outbreaks recently in Los Angeles, LAX. People are not wearing masks. They're not required to wear masks. Does that concern you and your membership?
It does concern us, and I'm seeing it in my own practice. I'm a staff nurse, right? And I've seen our numbers, hospitalization numbers for COVID patients double in the last week or so. And I'm a couple hours north of LA. So it is a problem. We are concerned, and we want to make sure we're vigilant in asking the public's help to follow the precautionary principle. Make sure you're wearing your mask, distance, wash your hands, do all of those things, right? So that we...
It seems like the government is now saying like this is the new normal to expect to get COVID. Is that what do you think about that whole ideology that we just have to accept that people are going to get COVID and there's nothing we can do about it?
I think the science tells us otherwise. It says if you wear a mask, you can prevent transmission. Who wants to get COVID? Yes, there are a lot of different variants now, and that's because we're not consistently following the precautionary principle, wearing our masks, distancing, especially indoors and in large groups of people.
And your union has also taken up the fight for national health care. public health care. What would that mean in California to the people of California if we had public health care?
Well, it's a huge deal for the people of California. We would be able to see that people would be treated without a problem, right? If somebody has COVID, then they would get the treatment they need. If somebody has a heart attack, they would get the treatment that they need. We wouldn't have our hospitals filling up like they are if we had Medicare for all, so that we could do the preventive education and preventive care to make sure that people are cared for and get timely medications and treatment.
And you've been working on this many years, your union in California. Where is it? We're single payer in California at this point. Gavin Newsom, the governor, promised it.
Well, we're making great strides with it, and we're not going to give up, right? We don't give up on our patients. We're not going to give up on single-payer health care in California or nationwide. We're going to fight till we get it, because everyone deserves to have health care. It's a human right.
And your union has been growing around the country. It seems like a lot of nurses are fed up. They want protection of a union. Is this a sign of what's going on in the healthcare industry?
Yes, we're getting calls from all over the nation, and we even connect with nurses around the globe. So we are organizing throughout. I think we're the fastest growing union, and we are organizing throughout the United States. People are calling us every day, and we're prioritizing, and we're at least trying to give the nurses the tools that they need in order to unionize their hospitals so that they can have a voice in a safer work environment and all of the equitable things that we receive in a contract.
And this is even taking place in the South, where your union is organized.
Yes, we've recently, I believe it's North Carolina, we have and even Maine. We're throughout the United States, and it is taking hold in the South because those nurses are fed up. They want to make sure that they have a safe work environment and that they have a voice in advocating in the best interest of their patients, themselves, and their families.
If you have a union, you have more protection against retaliation around health and safety issues.
Yes, if you have a union, you have a protected voice, but you also want to be able to recruit and retain qualified nurses through a strong union contract that has professional practice language, that has pandemic task force language, so that we get the things that we need and the resources we need in order to take good care of our patients.
And in California, the CNA has been successful in getting a patient ratio in the hospital. How has that changed healthcare in California?
Oh, I can tell you firsthand because I worked without the ratios. And it's also by acuity how sick the patient is. It makes a huge difference. Even during the pandemic, we saw nurses from all over the United States turn into travel nurses to come to California because they knew that our working conditions, although they were pretty dire, we still had and enforced the nurse-to-patient ratios in addition to how sick the patient was. And so we are seeing that we have a federal bill as well, because it shouldn't just be California. Because for every added patient to a nurse's assignment, there's a 7% increase in mortality rate. So the evidence is there. We need to make it nationwide. There shouldn't be one state versus the rest of the states where patients are safer.
So you're less likely to die in California.
You
have ratios.
Yes, and there are studies to prove that. Yes.
And there's a kind of an anti-wave against the public control, blaming nurses, blaming healthcare workers. What do you think about that whole approach, blaming science? There's an attack on public workers and healthcare workers around the country, blaming them. There have been fights. Nurses have been attacked by people who don't believe in masks. I mean, it must be pretty stressful for your members.
It's very unfortunate because we're the ones that are there. We're the last line of defense for our patients. We continue to go in every day and care for them. And it's unfortunate when we hear of these situations where nurses are attacked or blamed. What we do is say, look at the science. The same science I'm using to save you on my operating room table if you have a heart, if your heart stops, is the same science we're using for COVID. And masks are effective, in preventing the transmission.
How can people get in touch with you?
They can look up www.calnurses.org, and we have a lot of different issues and on our website, and you can get your questions answered there.
Power! Union! Power!